Okay, so we're going to start here in the abdomen, and we're going to just essentially start with the abdominal viscera first. We'll walk through some of the parts and pieces of those organs that we're going to be seeing within the abdominal cavity, and then we'll move into some of the more specifics of the vasculature and some of the nerves. So as we look at this dog here, we see that cranial is here and caudal will be here. We see at the cranial-most aspect of the abdomen, we would have the muscular structure, which is the diaphragm, and if we peel that or reflect it cranially, we can see the different lobes of the liver. In order to help identify these, I always tend to start at the gallbladder itself. We see that structure right here. The gallbladder is pretty much always located in our domestic animals between the quadrate lobe and the right medial lobe. So from there, you can work your way around. If we look at the gallbladder, we find our quadrate lobe. We'll have our left medial and left lateral lobes. If we recenter ourselves on the gallbladder, we see our right medial lobe, right lateral lobe, and finally our caudate lobe, that's composed of two different processes. We have this piece, which is going to be kind of capping the cranial aspect of the right kidney. That's the caudate process of the caudate lobe. And then we have this piece here, which is just kind of cranial to the stomach. That's going to be the papillary process of the caudate lobe. The lesser omentum is this kind of stringy lace-like material we see here that's going to be draping over top of that papillary process. Now I'll reflect the liver to see a couple other structures associated with the liver, specifically this structure here, which is the left triangular ligament. And then finally we have the coronary ligament that is going to be attaching the liver to the caudal aspect of the diaphragm. This specimen does not have a great representation of a right triangular ligament, and the only thing left of the falciform ligament in the dog has degenerated to be this globoid or globular fat that we see right here lying along the cranial aspect of the Linea Alba. If we go back to the liver and reflect that liver to the side, we can now see the stomach. The stomach, or the esophagus, is going to be traversing down caudally to empty at the cardiac ostium of the stomach. So this would be the cardiac part of the stomach where the esophagus is entering into the stomach. We then have this kind of free balloon flap up here, and that's going to be the fundus of the stomach. We then move into the largest portion of the stomach, and that's going to be the body of the stomach, or the largest lumen or piece of lumen is going to be the body of the stomach. At this point, this structure here is the angular incisure, this very acute bend in the lesser curvature of the stomach. And it's at this point that the body transitions into the pyloric part of the stomach, with the pyloric antrum being this thin-walled initial chamber, followed by this thicker walled chamber, which is going to be the Pyloric Canal. The exit of the stomach is going to be the pylorus, which is where the Pyloric Sphincter is going to be located. And at that point, the ingesta would move from the stomach into the proximal portion of the small intestine, which will be the duodenum. Here the duodenum has been opened up. An incision has been made in the antimesenteric surface of the duodenum. We see the cranial duodenal flexure would be represented right here. And then we would move into the descending duodenum. Associated with the descending duodenum, we have this structure that looks glandular. That's going to be the right lobe of the pancreas. Within the descending duodenum, if we open that lumen and clean some of the mucosa away, we can see two discrete structures here. The most oral structure, or the most proximal structure we see, is going to be the major duodenal papilla, and a few centimeters caudal to that is going to be the location of the minor duodenal papilla. The bile duct, which we see right here, leaving the liver, is going to be emptying onto the major duodenal papilla, along with the main bile duct. The accessory bile duct would then be emptying onto the accessory pancreatic duct. But again, you have to kind of remove this mucosa in order to see these structures. If you continue down the descending duodenum, at the caudalmost aspect of the abdomen, you will approach the caudal duodenal flexure. At this point, the duodenum transitions into the very short ascending duodenum, and then we'll transition from the duodenum into the jejunum at the duodenojejunal flexure. It's at this point that we will start to see those jejunal arteries, which are forming those jejunal arcades, those really nice kind of arching arterial structures throughout the jejunum. The jejunum will be occupying the ventralmost aspect of the abdomen and is quite long in here. We're going to move this structure, which is the greater omentum. We're going to reflect this out of the way. Here we can see the superficial wall of the greater omentum. As we reflect this structure cranially, we can see the deep wall of the greater omentum that was originally in contact with all of the viscera that we are currently looking at. As we continue to trace the small intestine, we will come to the point that the small intestine, or the jejunum of the small intestine, will then transition right here into the ileum. So we see here, just for orientation purposes, this area is the jejunum, and the jejunum will be transitioning into the ileum. So this structure here between my hands is the ileum. The ileum will then continue and will eventually meet and connect to the ascending colon. And it's at this ileocolic junction where we will have this kind of tortuous blind sac, which is the cecum. Now, if we open up this region, we can see the cecum has been opened right here, and we can see the cecum would be emptying into the ascending colon, and the ileum, if I pass this probe, will be passing into the ascending colon as well. This would be the ileocolic junction or orifice. And right here, if we clean some of that material out, we can see this little out-pocketing of that ileum into the colon. That's going to be the Ileal Papilla, where the Ileal Sphincter will be located within. Now that we've transitioned from the small intestine into the colon, we can now look at the other parts of this. And I'm going to reorient this to how it would be in the body. So we would have our ileum coming in to the cecum, and both the ileum and cecum emptying into the ascending colon. Very short initial segment, after which we have the right colic flexure moving into the transverse colon, and then we will have the left colic flexure, which will then transition into the descending colon. And the descending colon will then take us all the way caudally to the rectum. Okay, the last thing that we really need to point out here is going to be this piece of pancreas, which is coming over towards the stomach. This is the left lobe of the pancreas. And finally, if we look at the root of the mesentery here, we're going to see these very discrete, distinct structures, look like little balls of tissue. These are all of the mesenteric or jejunal lymph nodes that are going to be at the base or within the root of the mesentery.